Hey everybody, it's me, it's Dr. Campbell, just sitting here in my general practice today, Pro Solutions Dental Group, but also reaching out to all our friends in the Dental Success Network, as well as our friends in the Advanced Prosthetics Institute, or API. I have been sharing some information about, some of the new advancements that we've incorporated into the practice, and one of them is the ability to draw blood and take our patients' own blood and spin that down into a membrane that we can use and a tissue that we can use in extraction procedures and surgical procedures that really helps because the plug that we can take and make in something that we call platelet-rich fibrin, or PRF. It's full of platelets, which carry a lot of growth factors and a lot of white blood cells, and also the fibrin tissue, or the scaffolding, to help in the healing process. And so we've incorporated that into our surgical protocols. And my good friend, we're not going to share names today, but my good friend is here with us today, and she was just raving to us about her post-treatment. We did an extraction on tooth number 32, and she was just raving about the experience that she had in the aftermath of that surgery. So kind of share with me your thoughts on that. Do you mind?
This was the most miraculous thing. No pain afterwards. I was absolutely amazed. Healing took place so quickly. I flossed very gently around the area for the tooth that was in front of it, trying to be careful. No infection, no antibiotics.
Yeah.
It was absolutely astounding, and how quickly it repaired itself.
Yeah, it's amazing. So the tissue really, what happens is it speeds up the healing process. It takes us into earlier phases of healing instead of waiting for that inflammatory phase to pass and then get into the proliferation phase where all the new cells come in. And in the process, it's so packed full of white blood cells that it really reduces the chances of infection in the aftermath. So one of my friend's complaints has been in the past that when she has procedures done and she has to take antibiotics, it affects her digestive tract and brings on yeast infections, and the aftermath of antibiotics is really quite complicated for you, correct?
Yes, absolutely.
Yeah.
And I didn't realize that I wasn't prescribed an antibiotic until I got home, and I thought, oh, that's strange. I didn't need it.
Yeah. So the ultimate goal, the things we should be working for on behalf of our patients, what we're working on in our own community here in Prescott, Arizona, is really to provide these procedures for our patients with as little complication as possible. Reducing post-treatment pain has got to be the goal. It's not to say there might not be discomfort, but pain is very different than discomfort, and we want to make sure that our patients aren't experiencing that.
Absolutely.
Second thing is just reducing your risks for swelling and inflammation. Those are the things that are going to bring on pain, stepping past discomfort. And then post-operative infection. That's definitely what we're trying to help our patients avoid. So, and it's a great protocol to our doctors out there. If you haven't had the opportunity to look into the technology, it's simple. Once your staff is trained and you can draw blood and you've got the equipment to do it, producing the fibrin plugs isn't super complicated, but the benefits in the aftermath are just tremendous. And our dear friend, I think, can attest to that. So just want to say thanks for joining us today. And I definitely want to thank our friend here today at our general practice for sharing her experience in the aftermath of a dental procedure that she wasn't so anxious to have, but, grateful that it went well.
You get a gold star.
Thank you,
Absolutely.
ma'am. So we're going to chime out today, and we've got one more thing we've got to do for her today, so we're going to get on with it. Have a great day.